continuous glucose monitors, CGMs. Should individuals who do not live with diabetes wear them? People living with diabetes have praised public figures such as SD Haim for sharing their experiences. https:/nymag.com/strategist article diabetes products and visibly wearing CGMs in public. However, a concerning trend has emerged. Celebrities, elite athletes, and influencers who don't live with diabetes are now sporting these wearable devices, which offer near real-time glucose tracking. A video featuring Gwyneth Paltrow, an actor turned wellness influencer, https:/nymag.com/film, 2025, July 30th, 10 Things We Learned. Gwyneth Paltrow starts with her arm displaying a CGM before she makes grain-free almond and coconut pancakes. Many viewers questioned her use of a CGM, noting that some diabetes patients struggle to access these devices. https://www.theguardian.com/society 2023 Dec 09 Deprived Families NHS Diabetes Devices. Other influencers have promoted CGMs to non-diabetic individuals, claiming they can improve metabolism and energy levels. https://www.bbc.com/news/C1DDK1DDME50. Dr. Fiona Willer, president of Dietitians Australia, expresses concern over the rise of these devices, questioning if some users may enter a wellness rabbit hole. What is glucose? Glucose, the sugar in our blood, helps fuel cells in our body. It's similar to petrol in a car, needed for energy. Willer explains, any form of carbohydrate we eat, from lollies or whole grain bread, is converted into glucose, flowing into our bloodstream. The body also recycles glucose from stored food, Willer says. Diabetics need to monitor glucose levels because their bodies cannot produce or use insulin. https://www.betterhealth.vic.gov.au/health conditions. Blood glucose fluctuations occur naturally for those without regulation issues, but tightly controlled for those with diabetes. CGMs work by measuring glucose every few minutes using a sensor between cells and sending data to a receiver. Unlike finger prick tests, CGMs help manage glucose levels through diet changes or medication. For diabetics, CGMs improve quality of life and support pregnant women with gestational diabetes and insulin-dependent patients. For non-diabetic individuals, CGMs can track blood glucose after meals and exercise, but warn about potential anxiety or stress. They are expensive for those without government assistance, costing over $100 for a 14-day sensor. Should non-diabetic individuals use CGMs? A study by the University of the Sunshine Coast in 2022 found minimal benefit for healthy athletes without diabetes. Researchers also noted lack of evidence supporting claims that CGMs benefit people without diabetes, urging commercial claims to be misleading. Dr. Willer highlights that a magic number for glucose isn't realistic for someone without insulin resistance or diabetes. She warns that CGMs could lead to restrictive eating habits. It's like calorie counting, she says, noting that one metric might oversimplify health. Willer recommends consulting dietitians or health professionals to understand CGM results against real behaviors. Natasha May, Guardian Australia's health reporter, discusses antiviral research for health headlines. Antiviral, https://theguardian.com/series/antiviral, is a weekly column interrogating health claims and fact-checking popular wellness trends.